underbone extension. So do I just like right click you? Oh,
hey! He's huge. Cursed body parts, longer leg surgeries, and Steve's heart? Huh? Today, we are breaking down all of the blocky medical scenes and 3D surgeries from Minecraft. Let's dive right in.
Dr. Nestor, thank goodness you're here. Your patient is ready to see you. Oh, wait, what did I get? Oh, I got my white coat. Nice. Okay, so doctor approved white coat.
The doctor approved white coat. I mean, I have one here. Do I wear one at work? No. We have a whole closet for all the ER doctors for their white coats with their names on them, emergency medicine. Very rarely does anybody wear them. We wear them if it's cold in the emergency department, but I do wear scrubs.
Scalpel and a syringe, which is, oh my goodness, we got a needle in Minecraft.
There you go.
Okay.
Obviously, we use metal needles, but we don't actually use syringes that are metal. We actually use syringes that are plastic. That way they're easily disposable. Same with the needles. We'll throw it away in a sharps container that's available in every room or around the emergency department. We have needles of all different shapes and sizes.
Help, doctor. I was mining and got an emerald and gold ingot stuck in my body. Oh gosh, okay. It's literally a villager with, I guess, an emerald and a pickaxe on its head. Okay.
I've literally seen people come in with stab wounds, hammers, and different types of axes to their head, but never actually sticking in their head still when they've come in.
So what am I supposed to do? Patient chart villager. Okay, so we got the pickaxe in the head, an emerald in the nose.
Yes, we definitely see foreign bodies in people's nose. Typically, that's more of a pediatric population thing. We actually have a really cool balloon syringe that's plastic that we can actually sneak past the object, blow the balloon up, and then pull it back and able to pull the foreign body out.
And then an ingot in the intestines.
So the ingot, this nice big bar of gold in the intestines. Well, there's a lot of feet of intestines to try to figure out where that is and how to get it out.
Scalpel, so okay, so let's remove the pickaxe first. Gosh, okay, let's keep pulling.
Wow, it's actually like bleeding. This is pretty impressive. I didn't know Minecraft actually had this in it. So bleeding, you got to get it out and then have bleeding control.
Wait, what? Stop the bleeding? There has to be something around here that'll help. Oh, we gotta get bandages apparently.
Somebody's actually bleeding out. You want to hold the area first. Yes, you want bandages. You want something to block it from bleeding. But if you actually see a bleeder, we got a bleeder! And it's actually an arterial bleed. You literally just put your finger on it. It'll stop bleeding.
Do not die on me. Okay, couple bandages. And there we go. The bleeding is stopped.
Nice.
Great success.
You want maybe a little bit of bandage and gauze and put pressure on the area. And that's how it gets a clot to form and stop. You only have a couple liters of blood in your body. So if you lose one, you're going to go into a hypovolemic shock. May not be compatible with life.
And we ended up getting a x-ray. So I'm going to guess the x-ray right there is telling us that there's pretty much an emerald on his nose, as you can see on the right. And when I right click it, it says the patient has some cranial damage. You'll need to use a scalpel.
It may not actually show up on an x-ray, so it's not that beneficial. But an x-ray will help with the fracture. We can see if, obviously, if the axe went through the scalp, there's more than just bleeding control that needs to be done.
I'm sorry if this hurts, but I'm gonna try my best. Here we go. Oh, there we go. Okay, so just like that, we got the nose out of the way, and that feels much better, Doc. Can you remove the gold ingot inside me now? Open the villager with your scalpel. Now we gotta literally do intestinal surgery. Let's real quick right click him.
Oh, there you go. A nice little box open. We see the chest cavity as well as the abdominal cavity. A nice set of ribs. We have 12 ribs on each side versus 4.
We are now looking at inside of a villager. Why he's not bleeding? No idea. But
there's no blood in the villager. And it just took out all of the internal contents of the chest and abdomen. They're very much connected in so many different ways.
We're connected.
Okay, we have the blocked intestines now. So I think we just got to pull out the gold ingot now. So let's go to right click. Oh, we did it. Okay, place back.
Nice, cool.
Intestines back. There you go. Do I put the back?
Just staple all that stuff back on there. Super easy, right? No, there's so many different ways that you can actually put somebody back together, so to speak. You can use suture material. You can use staples, absorbable sutures. Everybody on the planet wants absorbable sutures. Very rarely in the emergency department do we actually use absorbable sutures.
So next patient is going to be the iron golem. And
iron
how's this going to
golem.
work? Right click. Oh, and it's literally a golem.
Oh, okay. All right. This character is huge.
Huge.
Something in my circuits doesn't feel good. I think I might have bugs. Oh, okay. That is a big boy. So I just got to make an incision now.
Whoa.
Okay, so do I just right click him? Oh, iron golem heart control room. What the heck? Okay, wait. So are these his bones?
Oh, he's inside. Oh my gosh. That's funny. I see a lot of bugs come through the emergency department. Kids who get pinworms. These are like the little worms that come out the butt where kids like scratch their butts and then they pass it along to other kids because it's underneath their fingernails and then you ingest it and then it plays that life cycle.
It's a vicious cycle.
Kind of gross.
A synthetic nerves.
Synthetic nerves. Interesting. Is that a real thing? I haven't heard of synthetic nerves. Hopefully they're being developed. That'd be awesome.
And the next patient is gonna be the Enderman. Hi, Doc. It seems that I'm unable to teleport. Ooh.
All right.
Okay, I guess we can figure that out soon. And it says inspect the Enderman.
The Enderman looks like super dark and mysterious. Who is the Enderman? Please, somebody let me know in the comments.
Maybe it's missing something. All right, so patient chart, Enderman, what do we got here? Procedure cannot teleport properly, and I guess we gotta do surgery. Well, I guess let's get out the scalpel and
all right, scalpel. We get to see the Enderman. Very similar anatomy to the villager.
He says, could you make my legs longer too?
Oh my gosh. Has anybody seen the movie Gattaca? Ethan Hawke was the main character. They made his legs longer. Probably painful as heck to have that kind of surgery.
Enderbone extensions required. He definitely is a shorter Enderman, but I have just the right thing for you.
He's got very, very long arms. In medicine, sometimes we think, okay, somebody has really, really long arms. Could they have Marfans, like a Marfanoid body? It has to do with a connective tissue disorder. Very interesting.
Enderbone extension. So do I just like right click you? Oh!
Hey! He's huge. All right, another happy customer.
Another customer.
Very cool.
Hey, what's up, Mr. Brian? Okay, so Nestor, I think my heart and eye are
cursed.
Oh gosh, wait, why does he not have any eyes? This looks so
wait, those aren't like normal eyes in the game. That look like he had eyes. We definitely get people who come in, not necessarily saying that they're cursed, but they believe 100% that there's something wrong. We will do blood work and imaging. Sometimes people will present multiple times to a doctor with these symptoms, and no matter what the doctor does, you do all these studies and they're normal. It frustrates the patient, but in the emergency department, we're limited by the resources that we have.
I'm limited by the technology of my time.
Real quick, let's go ahead and grab this. The patient chart for Herobrine, which says produced patient has an infected with a curse.
Oh.
Surgery needed to remove
the curse.
Gosh. Okay, so how are we gonna do this?
Scalpel.
Do I just right click him? Scalpel out. Let's do this.
Oh, look at that. It's got a black heart.
Black is the ace of spades.
Okay, this looks so cursed, guys.
Yeah.
Yet again, we are now opening up the insides of Mr. Herobrine. And is this a corrupted heart? Do I just grab that? Oh, there we go.
There we go.
Make sure to put that in a biohazard container. It looks infected.
Wow. So infected in the game, black, gnarly looking. We typically don't see the heart very often. I've held a heart in my hand maybe 5, 6, 7 times when we've cut open the chest in an emergent situation.
Now I need a new heart. You can take one from an unsuspicious Steve on the wild. One real quick. I'm gonna go in for the hit. Oh, and we got him. Yes. Okay. With that being done, there goes Steve, and we got.
Wait a minute. You're finding like a fresh donor in this game to give a heart? What? Come on.
Come on.
Maybe the villager will be okay, but I'm just gonna put it in here.
Whoa, that's not a biohazard container. Uh-oh. Hopefully nobody comes around that finds it and they get infected with this cursed heart.
Let me put in the heart real quick. And did it work? Oh, there we go.
Nice. Putting back the heart. Obviously, this is Minecraft, but when somebody's heart is removed, they're actually on a bypass machine that's like circulating the blood in the body. So there's different types of tubes inside the major blood vessels of the body. Very complicated. Very cool.
Okay, now my eye needs some help. Maybe some bandages could do it? I think I do have the bandages again, so do I just like right click them? One more. Hey, there we go. He's back. What's up, man?
Eye bandages are very interesting. They have like eye patches that are quite helpful for individuals when there's a corneal abrasion or you're having this inflammation due to the arc burn. You have iritis or keratitis, all these different things where there's inflammation of the eye itself. This was actually quite entertaining and fun. If you guys enjoyed this, definitely check out this playlist right here, binge watch everything, and make sure you subscribe, turn those bell notifications on, and hit that like button for me. Thank you so much for watching, and stay healthy, my friends.